AM 860 and FM 95.1 Weather Center. Mainly sunny today, high of 65. Tonight, increasing clouds, slight chance of drizzle, low near 43. Cloudy on Wednesday, chance of rain, high of 55. Wednesday night, cloudy, areas of rain, low near 37. High of 42 on Thursday, occasional sun, chance of rain. Thursday night, low 25. I'm weather meteorologist Laura Lockwood. Right now, 45.
KWPC AM 860, FM 95.1 is proud to present the Health and Wellness Series, the show that informs you about what you can do to help improve your health and well-being. Listen for educational conversations with professionals from around the Muscatine community. Now, let's start the show with your hosts, Tim Scott and Mary Hopkins.
And good morning, Mary. How are you today?
I'm doing great. Tim, how are you?
I'm doing well, and good morning to our guests as well, Jarod Johnson and Tanner Clark. Dr. Jarod, I know you, but I don't believe that I have met Dr. Tanner Clark.
Well, thanks for having me, Tim and Mary. Appreciate it.
So, Jarod, you started the practice at Arctic Dental. That's correct, right?
Yeah, opened a pediatric dental clinic here in Muscatine, Iowa, and we started the office about 2.5 years ago. So we've grown quite a bit, and we've worked quite a bit extensively with Dr. Clark. He works really well with our patients, and we try to do a lot of things early, which we're going to kind of talk about today. We're really excited to partner on this, and 2.5 years, we're starting to get to the point where we're seeing some of his cases finished. So outstanding results from his office and his wife and their practice. So they've been a really great asset to work with in the community, and we look forward to working with them down the road here.
Can you describe to me a little bit about what each one of you actually do? What are your roles?
Yeah, so I work with my wife, who is also an orthodontist, and we're orthodontic specialists. So what that means is that we did go to dental school and graduated dental school, and then after dental school we're very interested in orthodontics, and so we obtained specialty training in orthodontics, which is a 2-year residency program at the University of Iowa, where we concentrated specifically on comprehensive treatment of children, adolescents, teenagers, and adults, specifically for orthodontic treatment. And so the patients that we see, can vary from patients that have just minor crowding, where they just need a few teeth aligned, to patients that are more complex and may need orthodontic surgery to correct their jaw discrepancy with their jaw, or patients that have cleft lip and palate. So we specifically treat patients for orthodontic needs. How
young should parents think about bringing in their children to the dentist? At what age?
So our Academy of Pediatric Dentistry, the American Dental Association, and then also the Academy of Pediatricians recommend that the first visit occurs when the first tooth erupts or by age 1. And the reason for that is a lot of people don't realize that cavities are the most common chronic disease of childhood. It's more common for a kid to have a cavity than to have asthma, diabetes, obesity, and all those diseases actually combined. So it's really common to see, and if we can get the family in and go over prevention, it's a totally almost 100% preventable disease. Not quite, but it's something that we can get in and work with the families on, rather than having to. I go to the OR tomorrow here in Trinity, and we have a few kids that have some work and they aren't able to sit for it at the office, and then unfortunately sometimes we have to have them put to sleep, and we'd like to try to avoid that if we can, and then also prevent problems from coming bigger down the road.
Why would you have to have a child sedated to that point? Are there different things that children experience that it's just uncomfortable for them, or?
Yeah, children, we want them to have the best experience we can, and also the safest at our office. So my residency program was 2 years down. I went down to Las Vegas, and that's where I learned to, how to work with kids, and also learn sedation. We do different types of sedation. So we do a conscious sedation at my office where the kids are awake, kind of sleepy, and then that's not enough for every child, and sometimes they have so much work that we look at the sedations at the office, and if you were looking at 2 or 3 of those, the risk of that may be greater than doing one where they're completely asleep at the hospital. And we work with a lot of kids. We have tons of kids that don't need it, but sometimes there's just enough cavities in a kid, and they're big enough and they're young enough that they might not be able to get that care facilitated and get things taken care of, because obviously down the road it can cause some extensive problems, not just with pain, swelling, and infection, but also with orthodontic treatment. If we lose a baby tooth early, the first one comes in around 6 months and the last one leaves around age 12, and if we lose one early, there are adult teeth coming in, and they want to come in and go wherever there's space, and if there's space there, they're going to pop into that space and fill that gap, and we're going to be looking at maybe more extensive orthodontic treatment or possibly extractions and things that maybe could have been prevented, or maybe we have a patient that doesn't need braces if we just would have been able to save that tooth or place some sort of space maintainer.
So a couple of weeks ago, Doc, when you were in here at the radio station recording your commercial, we were talking, and I know we're talking specifically about children, but we were talking about, I was expressing to you some of my earlier experiences with a dentist, and I'm an older guy, I'm 58. And back when I was a kid, you didn't have all this stuff now that you guys have, the numbing gel and different things like that. And it was very traumatic for me when I was a kid. Tell me what's changed from when I was a little boy up to the present time that makes it easier for a young person to be treated at the dentist.
Well, I think the changes have been in, just the training of dentists and how they look at treating a patient. Obviously, there are some kids that we still don't have the best experience for, because it's not worth the risk of, giving a kid drugs for maybe something really small. Maybe we wait and don't do anything, or maybe something's big enough that we have to get it done. We don't have a chance to wait. Sometimes my sedations are booked out a few weeks, and we don't want to have swelling or pain. So we just have a good mind set for our patients, and we want to provide the best for them. So the training and the conscious sedation is a great, kind of in between for the patients, and then the hospital is also great, but we have to kind of weigh the risks and benefits, because anytime we do give children medications, it decreases heart rate and breathing, and we want to facilitate dental care very comfortably, but we also want your kid to get up and walk out of the chair and be a happy camper and move on. So, that's what the extra training is for, and there's some kids in my office that just aren't candidates for sedation. I don't feel it's safe for them, and we have that conversation with the parents, and,
Sure.
We discuss everything, risks, benefits, and can we wait? We don't always have to get to everything right away. Some kids, we wait and we see them every 3 months, and if something needs to be done, we check it and go the other route. But safety is big for me, and comfort is too, and sometimes, there's not an ideal in between, but we got to do our best.
Right. You keep talking about it until you find a middle ground, and then you go from there. So are you both in the practice together?
We are not. My office is located on Cleveland Street, so right in between McDonald's and Hy-Vee.
Okay.
So my wife and I had purchased Dr. John Schlichter's practice about 4 years ago.
Oh, sure.
So we had known Dr. Schlichter from back in the past, and he had approached us, and just really felt that he had a good practice, and we're excited to take over his practice and his patients.
Is there a particular age generally when a patient can be a candidate for coming to see you and looking at, going to that next level of intervention? I'm thinking, are they adolescent-ish age, or when do folks start coming to see you?
Yeah, and so that's a great question, Mary. And so I guess I can't stress enough just the importance of children and parents having their children see a dentist, or in particular a pediatric dentist, at a young age. The Muscatine community is really fortunate to have someone like Dr. Johnson that is a specialist in pediatric dentistry. So he can kind of establish a good dental home for young children, and so we kind of have a good relationship. And when a child is ready to be seen by an orthodontist, we can intervene. So. To answer your question, typically the American Association of Orthodontists recommends that children be seen for an initial orthodontic screening by the age of 7.
Oh, okay.
So that may seem a little early, but the main reason is because that's when typically the permanent teeth start to erupt. And not necessarily saying that we're going to do any treatment at that time, but there's things that we evaluate when we see a child at that age. Typically, we're looking for proper eruption of the teeth. We want to make sure that the baby teeth are falling out or going out on their own as they should. We want to look if there's significant crowding where teeth are having problems come in. We want to make sure that the growth of the upper and the lower jaw is symmetric or as it should be. So, typically we don't do a lot of interceptive treatment unless it's necessary. There are some indications that it's necessary to do orthodontic treatment at a young age, and that's where we can work with Dr. Johnson, and he can identify those patients. But typically we want to see them at around the age of 7, and then if treatment's indicated, we can certainly go ahead and do some limited or phase 1 treatment, as we call it. If not, we'll see the patients back about every 6 to 12 months to continue to monitor their eruption and growth until they're ready for full braces, usually around the age of 12 to 13, when all the permanent teeth are in.
So regarding braces, when I was a young person, you didn't see very many people with braces, but nowadays you see a lot of people with braces. When did that all kind of change around?
Sure, I think parents feel that it's an important long-term benefit for patients and for their kids. So
does every child need braces?
Not necessarily. If a child has well-aligned teeth, they have a stable functional bite, there's not necessarily a need for braces. But for the most part, a patient or a child does have an overbite or crowding, those things that we can correct with orthodontic treatment. But that's why, again, it's important to have a patient or a child come in at the age of 7 so we can start to identify if those problems are going to need to be treated in the future.
And Dr. Jarod, at what age range would a child transition from your practice to Dr. Tanner's practice, do you think?
Well, we work together. So
Sure.
He's a specialist in orthodontics and I pediatric dentistry. So like he talked about establishing the dental home, I typically don't do orthodontic treatment at my office. There's a few minor things I may correct here and there.
Sure.
But, he really kind of takes over with the movement of the teeth and making the smile perfect for your child.
Okay.
And, I continue to work with keeping their hygiene up so they're brushing well during the time. We may see a patient more often if they're having problems with the braces and getting food stuck in them. And then also, if, God forbid, they get a cavity when they get the braces because they're getting more food stuck in there, that's something that we would go ahead and fix. And then the other thing that we work together a lot with is, like you talked about, those kids that go over early, maybe they're not doing things, but there's things like that we can see on the x-ray that we see a tooth's not coming in right. So we may want to get that tooth out of the way to try to let it drift back to try to prevent that from getting stuck. And it's pretty common for that to happen with canines. And that's a thing a lot of, I teach at the university, and a lot of, students they miss that because it's not a cavity. So that's something that, when I'm up there, I try to impart on them to definitely look at the canines and where they're coming in. And we don't want to have a tooth get stuck because we didn't get them over to Dr. Clark or we just missed it. So we work together really well, and we have pretty good philosophies on when teeth need to come out and when they don't, and we're not too aggressive on that aspect. So pretty much the things that he works on are the things that can get the teeth in the right position as the child grows.
So what are some good hygiene practices, and are these practices the same between children clear up into adults? So I'll preface that a little bit. So you hear different things. You hear reports saying you should use mouthwash before you brush your teeth every day, and then some news stories will say you use it after the fact. Some will say for adults, gargle with hydrogen peroxide. Some will say that's a bad idea. Just basic tooth care. Let's first start at a child age and then go up into an adult. What do you think are just basic day-to-day practices that people should follow?
Yeah, it definitely varies. I think the ADA, my license plate is actually 2 minutes twice a day. So that's like the big push. Like,
Okay.
We want you to brush your teeth twice a day for 2 minutes as an adult.
Perfect.
Okay.
With kids, it's a little different. You're not going to have a kid sit there and let you brush their teeth for 2 minutes. So what I tell parents is I say, hey, I get you're busy. I would love it if you would brush your child's teeth in the morning and at night. I get you're busy trying to get kids out the door. If you can only do it once a day, then nighttime is going to be the most important time. We don't make as much spit at night. So if we have food on our teeth, that we can have a little more susceptibility to cavities. And I say also to parents, we show them, when they come to the office, we show them pictures of how different ways to brush their teeth. It's not like they're going to sit there, so sometimes you sit on them, and that's what I had to do with my daughter when she was that age, and now she's getting to the point where she's getting up. We let her brush, but we definitely want parents going back and brushing the child's teeth for them until they can tie their shoes. So that's usually around age 7.
But you can get them, you can do little tricks like get them a toothbrush with whatever they're into, make that their toothbrush,
Yeah, we got Mickey Mouse,
right.
Minnie Mouse,
Yeah, exactly.
and, Winnie the Pooh and that. And then also, with the brushing at home, it's important that I just tell parents, get in there for a good 30 to 60 seconds. If your child wants to do it, let them do it, but definitely go back after them. And that way we can get the food and the plaque off the teeth. As far as when we transition into more braces and things, it's obviously really, really important that during that time that these kids and adolescents and adults that have the braces do a good job of keeping the teeth clean. A lot of my patients, I'll put on a prescription toothpaste that has some more fluoride in it to try to help give them a little extra bang, because I know they're probably not brushing 2 minutes twice a day like we would like. So
Sure.
anything we can do to help. And then you touched a little bit about on the mouthwashes and when to do it. I think there's mixed evidence out there, because there are certain mouthwashes that we have in dentistry that we use that if you use it at the same time as the toothpaste, it's going to bind to the fluoride. So it just depends on the product that you're using. And if you have questions, I would definitely, take the bottle in to your dentist and just get their opinion. They're there for you. They're the professional, and they're going to have a great understanding. Usually with mouthwash, that's something that you'd want to wait till around age 6 when the child can spit and use under adult supervision. Some of them do have alcohol in them, so they can cause a burning sensation. So there are alcohol-free versions out there, definitely to use. But I would just discuss all the products and things. Obviously, if we're not brushing twice a day, I don't expect you to use a mouthwash or floss. So let's work on the important thing and then pick up things later. We got to be reasonable, It's just like in any practice in healthcare that, I know that I shouldn't be eating a fatty meal, but I do it every now and then, and that's okay. So I think we just got to be realistic as practitioners. And I know Dr. Clark probably has some good tips here on when the braces come in and maybe different types of floss to use and different instruments, electric toothbrush. I don't know if you have an opinion on that.
Yeah, I think that the big thing, if a child is getting ready for braces, is one, to be in communication with the dentist or with Dr. Johnson, just to see if they're a good candidate for braces. Not everyone is a good candidate for braces in that respect if they don't have good hygiene. If they have plaque all over their teeth, if they're not brushing their teeth, if they have gingivitis. We don't want to put braces or appliances in their mouth because they're not going to be able to keep those clean either. So, I always tell my patients, I'd rather you have crooked teeth than perfectly straight teeth with cavities. So, our team at the office does a great job with educating patients and parents on proper oral hygiene techniques. We always stress to the patients and parents that you still need to see your dentist or pediatric dentist to see Dr. Johnson every 6 months, even when you have braces on. It's important to go in for your routine exams, your routine dental cleanings, just to make sure the gums are healthy, the teeth are healthy, and there's not cavities that develop. There are certain things that we can use or have the patients use. Dr. Johnson mentioned like an ultrasonic or sonic hair type toothbrush, electric toothbrush, that can help patients that maybe have some difficulty getting places in the mouth that are hard to get, but they still have to use it. So, brushing, we typically tell patients, after every meal, before bedtime, are the times we want you to brush. We do have certain things that we can use to get in between the teeth or in between the wires and the braces that we'll show them throughout treatment. So those can also help decrease the chance for cavities or gum disease. So education is really important, and also, continually educating the patients and the parents how important it is to maintain the health of your teeth when you are in orthodontic treatment. So.
All right, doctors, we're going to take a short break here, and we'll return with more of our show. This is the Health and Wellness segment here at KWPC. This is the Voice of Muscatine.com.
Banks are at it again, demanding that legislators raise taxes on Iowa credit unions and their 1.1 million members. They control nearly 90% of the market with 6 straight years of record profits, but banks want to eliminate the not-for-profit choice credit unions provide. If successful, Iowans lose. Auto and home loan rates will increase and interest paid on savings accounts will decrease, all to line the pockets of bank shareholders. Ask your legislator to oppose the banker's tax hike and protect Iowans' financial choice. Visit protectfinancialchoice.com.
For over 30 years, Great Clips has been the best value in haircuts. There are hundreds of styles available. One great haircut. Get a great clip for kids and seniors for $11 and adults for $14. Don't forget to download the Great Clips app. Check in and see wait times at your fingertips. Because until the world goes totally bald, we have work to do. Visit us on Highway 61 in Muscatine, across from Walmart. Great Clips. It's gonna be great.
Great Clips proudly supports Muskie boys and girls basketball. Go Muskies!
Rock Valley Physical Therapy would like to congratulate the Muskie boys and girls basketball teams for making the playoffs. The staff at Rock Valley are trained in all areas of orthopedics and sports medicine, with specialized training in occupational and hand therapy, blood and vestibular therapy, and medical nutrition therapy. If any of the Muskies have any accident, on or off the court, tell them to visit the expert team at Rock Valley Physical Therapy, making better lives. Located at 3414 Northport Drive, Suite 2. Go Muskies!
How well do your children see? You know the difference between an eye screening and a complete eye exam by an optometrist may be the difference between a child prepared to learn and a child with a vision-related problem. The Vision Center optometrists examine children that are unable to read an eye chart. Remember, routine eye exams are most important, knowing that 1 out of 4 kids have a visual disorder. Come to the Vision Center PC, only the finest care.
Auction weekend returns Friday, March the 2nd with Buy It Now Friday. Saturday, we'll be back live on the air taking calls for all the bid auction items. This year, the auction is bigger and better than ever with all your favorite goods and services like restaurants, furniture stores, salon services, contractor services, and more. Keep an eye on our website, voiceofmuscatine.com. There you'll find a complete listing of all the offerings on this year's auction, like $10 gift certificates from Mad Marv's, $10 gift certificates from the Flower Gallery, $10 gift certificates for China Garden, and a Fast Tan annual membership to Suntan City. Start calling at 6 a.m. this Friday. Buy It Now Friday on March the 2nd. Saturday, we'll be back live on the air taking calls for bid items. Auction weekend returns this weekend, and it's bigger and better than ever.
Most of us live the same way, paycheck to paycheck. That's why tax refund season at BillionAuto.com is such a big deal. With your refund, that payment you were quoted last year may now be much lower. If your banker recently said no, maybe BillionAuto.com can say yes. Stuck in a high payment? With your tax refund, you may be able to lower it on a new vehicle. Apply online for credit pre-approval. All applications accepted. Not all will be approved. Take advantage of tax refund season and view over 7,000 vehicles at BillionAuto.com.
Contractors, of course you have other places to buy materials, but we want to assure you, Muscatine Lumber will show you that the highest quality products are available at competitive prices, and our customer service will spoil you. We want to offer you every opportunity to buy from Muscatine Lumber, and we will guarantee it in several ways. Like price guarantees, we will match any bid from anywhere for the same materials. Like quality guarantees, we will source your materials from anywhere that provides you with the highest quality. Like delivery guarantees, have you noticed our new 69-foot reach boom truck ready to stack your shingles right on the roof where you want them? Come on, contractors, give us a try. Let us bid your next project and see that Muscatine Lumber wants to be not just your new choice, but your best choice. Come see us at 1700 Grandview Avenue. Thank you.
You're listening to the Health and Wellness Series with Tim Scott and Mary Hopkins. Now, back to the show.
Mary, I believe you had a couple of questions for the doctors.
Yeah, I was curious to know, in terms of braces, is there an average length of time that it takes a child to get through braces? What can folks expect?
Sure. So it's all based upon the patient's severity. If they're severely crowded or if they have a severe discrepancy with their bite, obviously those types of treatments will take longer. If a patient or a child comes in and they're kind of in a mix between the permanent dentition and the early dentition or the primary dentition, a mix between baby and adult teeth, Usually we're just treating that patient just for a limited type of treatment, maybe moving one tooth out of crossbite, or doing an expander to expand their upper teeth and their upper jaw. Typically that takes anywhere between 6 to 12 months. And that type of treatment, again, is more of a limited type of treatment. It's not going to negate the need for full braces later on, but it's going to make a smaller problem, or not develop into a larger problem when they get into their permanent dentition. So, usually when they're younger, anywhere between 6 to 12 months. Now, when patients or children or teenagers or even adults, when they have all their permanent teeth, the average treatment time is usually around 2 years with braces. So again, that can vary based upon the severity of the patient's crowding or of their bite, but typically it's around 2 years.
And what can a patient expect in terms of adjusting to having this hardware in their mouth, and comfort level, and kind of just adapting to sort of a new way of life for a little while?
Sure. So we always tell patients, whether they're children or adults, that they are going to have some mild discomfort for the first week when the braces or appliances are placed. That's because the teeth are just starting to move. They've never been accustomed to having anything in their mouth typically before. The inside of the cheeks, the lips are going to be sore. So those are all things to kind of expect that first week. So it can be a little bit rough, but typically we'll recommend taking ibuprofen as needed, Tylenol as needed. We'll give patients some wax to kind of cover up some of those areas that may be kind of rough or sharp to the inside of the cheeks or the lips. But typically after a week or so, they're pretty adjusted to having the appliances in place, and really don't have a problem after that.
And what is the maintenance schedule? So now these appliances are in place, and they've got their approach for home. They know to continue taking good care of their teeth. They've got the wax, the ibuprofen. When do they come and see you again?
Sure. So typically after the braces or appliances are placed, we'll see patients back anywhere between every 4 to 8 week intervals. Those appointments are usually shorter. What we'll do is that we'll change the rubber bands, we'll change the wires, make small little adjustments with the teeth, the alignment of the teeth and of the bite. So usually every 4 to 8 weeks we'll see them back.
And do you guys do those fun, colorful bands so kids can, show their personality or their school colors?
We sure do. Yep. Big one now is probably green, I would say, at the office with St. Patrick's Day coming up.
Oh,
but
of course.
No, we've got all sorts of colors, so kids have fun with it, and even adults have fun with it too. So.
And with every 4 to 8 weeks, you can be pretty themed. You can
sure
hit whatever's coming up
sure
next.
Can, yeah. Usually purple's a pretty popular one with the Muscatine colors.
Of
too,
course.
so.
I don't need to tell you about this. I'm
Right,
sure you
right.
could educate me.
Right.
Does most insurance cover braces, Doc?
So insurance does cover a portion of braces, and typically orthodontic insurance is a separate benefit than dental insurance. And so usually,
I'm going to have you talk a little bit more into that, Mike. There.
Sure. So typically orthodontic insurance is a separate benefit than dental insurance. Usually people will have a separate amount to use towards orthodontic treatment. And that's all based upon the insurance plan. So that's always something that will let patients or parents know their benefit before they begin treatment. Also, things that they can use towards treatment are flex spending accounts, health savings accounts. So that also kind of mitigates the investment towards treatment.
Dr. Jarod, can you specifically tell me what kinds of things you've done to make your practice really kid-friendly? Because I know you have a great practice there. What are some of your trade secrets that you've done?
Well, we got quite a few bells and whistles, and the biggest thing I think for kids is to have choices. And one of the neatest things that probably you wouldn't see, but we kind of do behind the scenes, is I've got like 10 different flavors of paste to clean their teeth, and they get to pick out their flavor. We've got marshmallow, chocolate, strawberry, cherry, raspberry, mint, chocolate, bubblegum, and the list kind of goes on and on. Those are some of the ones that I can remember off the top of my head. And if they get a choice and they can pick it out, that's something that makes them have fun. The different flavors. We also have different flavors for the fluoride treatments that we do, so that gets them a little more excited. One of them is caramel. That's one of my favorites. It smells really good, tastes really good. So when they get that put on their teeth, they can have a little bit more happy experience.
A little treat, yeah.
Some of the other things that we have, Love polar bears. We have a huge polar bear bookshelf in our waiting room full of books, and that was shipped from France when I opened up. It's it's a highlight for the kids to have in the office, and we've got dental books, just books. A lot of parents will come in and they'll start reading to their kids while they're waiting for us, and I'm also on the library board at the Musser Public Library, and books and reading are important too, and that's kind of a thing that I really, when I see a parent and a kid reading over, it's special. We have a train table for the little kids. That's popular. We have toy towers, treasure towers for tokens at the end of the visit. And then we also have, TVs on the ceilings. So if they're getting treatment, they can pick out a movie to watch. If they're not
TVs on the ceiling. That's
yeah,
nice.
And then we've got, if
Yeah.
they're not getting treatment, they're getting a cleaning. We got funny animal videos. I know it's pretty popular right now. The cats and dogs and goats and hedgehogs, they all do different funny things. And
I think I want to go to see you.
Tim,
You won't let me.
Tim, I was just going to say, I think we're too big for the chairs.
He won't let me. I've already asked him.
Well, we do have normal-sized dental chairs for kids, believe it or not.
How about for big kids?
We will fit, he says.
So, and we do have things for the older kids too. The treatment rooms and the chairs for the older kids' rooms are not as themed as childly, like the one's a frozen room, and then the older kids one, it's more just kind of a generic kind of theme, so they're comfortable as well.
In terms of time, are the exams on your littlest patients, are they a little more expedited just because of that whole attention span and patience being pretty low in your little patients?
Yeah, the exams are a little bit quicker, but we spend a lot more time talking about the changes that are going to happen with your child. So the exam probably only takes me about a minute to take a look at your child's teeth and evaluate how their teeth are coming in and where they're at. But the time that we spend after that is way more important. We go over things such as the eruption of teeth, what to do with teething, and I know there's been some things out in the news about teething tablets and gels, and we go over all that information. We go over diet and what causes cavities, what doesn't. We give you a list of over 50 things you can give your kid that are teeth healthy, and by all means you can have a sweeter treat every now and then, but we do want to make healthy choices as well. We also take time to go over how to brush your child's teeth, find things that are going to work for you and your family at home to make that happen. Ideally twice a day, but at least every day. And also, parents have a lot of questions. Can I use a toothpaste with fluoride or not? How much do I use? And, we answer all those questions. Some other things that come up are, my child grinds their teeth and different things like that. And then we also, unfortunately, we do have some kids that bump and fall, and that's the most common time around age 2. So we go over what to do if your child has an injury and how to get a hold of us, and that we're here for you if you need us.
What can be done if a child is grinding their teeth?
Well, typically, a lot of kids do grind their teeth. It's very difficult for us to make something for them to wear at night since they're growing and changing, and it gets very expensive. You don't want to do like a night guard or anything like that unless something happens where they're grinding through their teeth all the way down to the nerve, which is very, very rare. I've seen it once, but that's really rare. It's expensive as, the teeth are coming in. You'd be making a new one every few months, and it'd get pretty extensive. So grinding with the teeth is actually pretty normal in kids, and most kids grow out of it as they get older. And if they're still doing it with their adult teeth, or as they get older, we could definitely have things that we can do when they're transitioning over, such as like a softer night guard that's a little more cost effective, or making a hard night guard. We make a lot of appliances for those after the kids are done with their braces and orthodontic treatment, because if Dr. Clark's going to be moving things around, we don't want to make something that's custom and then it doesn't fit. So definitely things to consider when we're working with grinding.
Where did you both go to school at?
So I'm originally from Wisconsin, so I went to undergrad at the University of Wisconsin, and then came down to the University of Iowa to dental school, and that's where I met my wife Sarah. She was also in dental school at the same time. So after that, we both had military commitments. So we were general dentists in the military. I was in the Army, and then my wife Sarah was in the Air Force. So after our time in the Army and Air Force, we decided to pursue orthodontic specialty treatment or specialty residency at the University of Iowa. So Iowa's home to us, and we love it here.
Nice.
And I went to undergrad at the University of Iowa, and then also my dental degree at the University of Iowa for general dentistry. And then I had the opportunity to go to Las Vegas out in Nevada and learn there, and it was a great experience. The only specialties we had out there were oral surgery and orthodontics, so we got a lot of experience doing a lot more things than I maybe would have gotten to do at another school, and really prepared me to go through the board certification process as well. Board certification, Dr. Clark and his wife are board certified. I'm board certified. It's an extra level on top of our residency where you sit for some exams, and it's very rigorous, and it's a high standard that they hold people that are board certified to. And for the pediatric process, what we do is we take a written exam, quite a few questions. If you pass that, you qualify to go fly down and sit in front of your peers, and it's quite an intimidating process. They put you in a room not much bigger than where we're sitting now with 2 other specialists that are board certified, and
is there like a spotlight that they shine on you?
And then they put a case up and they start asking you questions, and it's like you're in your office, real world. And I know when I was in residency, we would watch the orthodontic students. They started preparing in residency, and they actually have to go and do a little more rigorous thing. They have to show some cases. Is that right?
We do, yeah. So we typically, in addition to the written exam and also like an oral exam, we have to present usually about 6 to 8 patients that we've treated with orthodontic treatment to a group of other peers that have been board certified. So it's definitely a rigorous process, but one, I think both myself and I can probably speak for Dr. Jarod too, that something that's definitely worth doing. It just makes you a better practitioner, a better orthodontist, a better pediatric dentist.
So out in the world of dentistry, we've got folks that are practicing that are not necessarily then board certified. Am I following this correctly?
Yeah, it's completely voluntary it's something that you do to further your education and just become the best you can be. And it's a voluntary thing. It's optional. Not everyone does it. It takes a special person to want to put themselves up and be in front of that standard of their peers and be judged by their peers to, be qualified, to have that title of board certified orthodontist or board certified pediatric dentist. So it's definitely a rigorous process. It's completely voluntary though, and there's a lot of great practitioners out there that choose to invest their time in other things and are great practitioners as well.
Is that from the AMA then, or who is that with?
It's similar to that. So each of our organizations have their own specialty organization that grants that award. I know the general dentistry, they have Academy of General Dentistry. They have a title similar, fellow and master, and I know some of the dentists in town have also gone down that route and completed those too. So we really have a high level of standard care here in Muscatine.
Mm-hmm.
And so at the end of the day, your patients are reaping the benefit of this extra level of certification. That's really wonderful.
Yeah, I think from our standpoint, when we see a patient in the office, we want to try to treat them how we would a family member. So you take great pride in the patients that you do treat, and you want to treat them to the highest standard and do everything that you can to ensure that they receive the highest quality care. And certainly having great dental practitioners here in Muscatine and specialists such as Dr. Jarod really makes that a great process.
Do you let the parents come in with the kids, or? Definitely.
I think you went back. I didn't answer your changes from the past, but that's definitely one of the things. I love having the parent in the room because it's very they want to be there. It's a big deal for them, and it makes things easier for me. If things aren't going well, I can stop and I can ask them, I'm pretty sure XYZ, your child's numb. We don't want to ever have a child have a negative experience, but if we're there and they're comfortable and it's something quick, maybe they choose to get it done, or if it's not, maybe we bump it up to go for sedation and make the child a little more comfortable. But if they're sitting there in the room, they can help you make that decision, and if the child's a little bit scared, or they can also help calm them down. So I definitely see the benefit to having them in the room, and I want parents to trust me. And what I've kind of found out is after they've been in the room a few times and they know their child's comfortable, and they know we're not going to do anything that we wouldn't want done to our children, that a lot of parents after a few years they don't come back anymore, and that's okay too.
Well, it's just that when you're little, you want your mom, you know, especially, or your dad if your mom's not available. But you always want your mom, right, when you're a little kid.
And that can make treatment more difficult too. I think I probably would be more successful if we didn't have parents in the room, but I don't believe in that. I believe you should be there to be with your child, and no one should be able to separate them unless, you know, we're obviously doing some sort of deeper sedation where it can interfere with safety.
Yeah.
But I think a lot of dentists, it's changing now. It used to be that you didn't get in the room, and I think parents are looked to as escape sometimes. You know, if you don't want to do something, you call for mom, and that can cause problems too. But I think that I'd rather have the parents in the room, and I enjoy having them in the room so they can see how we work with their child and how we talk to them. And a lot of times when I'm talking to the child, they'll laugh too. So
sure, you bet.
Much of what you've touched on today really gets at the heart of how important prevention is. We can just ward off future problems with lots of good care. How are we doing as a community with getting our children in to see the dentist when we should? I've got to admit, as a mother, I didn't have my babies in to see the dentist, you know, with their first tooth. So I'm recognizing, wow, you know, I could have done that differently.
Yeah, and I don't think there's anything. I mean, we'd like you to come in when the first tooth. That's our guideline, and you know, it's obviously life's busy. We have some kids that are going to have other medical things going on too that are important. So, you know, we can't just blanket that on everyone. But it's been hard, I think, for the community to have access to care, and that's part of the reasons that I came to Muscatine and started my office. I'm actually receiving some loan forgiveness to help out and see underserved patients here in the community through Delta Dental, and the Muscatine Health Foundation has been a big part of that. And our numbers are crazy. We're seeing a ton of kids that are underserved. We're making a huge difference. And you know, if they don't have access to get in anywhere, how are we expecting them to be seen? So I think the community has really kind of stepped up and stepped together to, you know, offer that loan repayment and loan forgiveness to me. And, you know, I'm going to step up and do my part too and treat them really well.
Yeah, I think since Dr. Johnson came here to Muscatine, you know, in our practice, we've seen the benefit of seeing patients and children at an earlier age, so we can help kind of prevent some of the orthodontic problems that maybe we weren't seeing in the past. The general dentists here certainly do a great job, you know, with all their patients as well. So, you know, I think everyone here is fortunate to have a good group of dental professionals here in Muscatine, you know, to take care of everyone here.
Would you remind our listeners how they can access each of you, and what's the best way of getting a hold of you guys and getting an appointment and being seen?
Sure. So typically at our office, we see patients for an initial exam, just to take a look and see if they're a good candidate for orthodontic treatment. Just a call to our office. Our number is 263-4900. You can access more information on our website, which is www.stclarkortho.com. And so that's really the easiest way to get in contact, find more about our practice, the services that we offer, and to schedule an appointment. We see patients of all ages, you know, even adults now, you know, really starting to see a growing trend of more adults being seen, you know, with orthodontic treatment too, with some of the new technology and new type of appliances that we have. So we're starting to see a lot more adults. So yeah. That's probably the easiest way, is just to give us a call.
You're such a good resource for our community. Oh, that's wonderful. People don't have to drive out of town to go and get their needs met.
How about you, Dr. Jarod? How can people get a hold of you?
Few ways. Our website, arcticdental.com, is a great way to kind of get to know us. You can take a tour of the office. You can kind of look a little bit more about what your kid's going to see, what we do. And then also, if you want to take the step and go ahead and make an appointment, you can give us a call, and it's 607-5979. And we do a lot of things on Facebook too. So if you're on there active, we're live on Facebook right now. We'll kind of repost this with the audio that you guys are missing later. But we definitely would love to see you, and we work very closely with Dr. Clark's, and they do an outstanding job for the patients that we get over there.
I've been reminded to encourage people to check out your Facebook page. You just mentioned that, but I want to encourage people to look for Arctic Dental on Facebook. You will be entertained. You will be educated but entertained as well. So go there. You've got your smartphone in your hand. I know you do. If you're not driving, check it out.
Yeah, we've got a lot of fun things that we've got planned too that I just haven't had time to get around with. But if you're looking for a fun thing for your kids to see, we got to go to the videos and look at the experiment. You can do that at home. It's an easy thing to do. Your kids are going to have a ton of fun with it and learn a lot about, what causes our enamel to wear away on our teeth.
So we've just got a few minutes left. What kind of new things do they have nowadays other than the old appliances where you would actually scrape at teeth to get plaque off? Do they have any kind of ultrasonic things now, or things that use, I don't know, a laser or whatever? I mean, how does it work nowadays?
Sure. So definitely technology's been kind of a big, kind of exciting topic in orthodontic field. Right now, our office is completely digital. So I think probably people that have had orthodontic treatment in the past probably remember getting the GUI impressions, before or during orthodontic treatment. Now we have a digital scanner, so that eliminates the need to have impressions in our office. So it's a better patient experience, but it also overall, I think we can get a better treatment and diagnosis from that as well. So that's been kind of a big game changer for our practice. Some of the new types of aesthetic appliances that we have, clear brackets, clear aligners such as Invisalign, those are all have their place and indications for treatment, but are certain different options that patients have now that they didn't have in the past.
Okay.
With advancements then, with new technology, how do you guys stay up on what's happening, what's evolving, and what does ongoing education look like for you both?
Sure. So, we're required to have a certain amount of continuing education as dental specialists. So, those types of new technologies kind of can play into a little bit of some of the continuing education that we have. I'm kind of a techie guy, so I kind of like to stay up on some of the new technologies, and that kind of translates into the orthodontic and dental field as well.
Is it easy or hard to get your continuing education? Are they dragging you off to any warm locations to get your hours met?
I'd certainly prefer that. Sometimes that doesn't always work out real well, but yeah, there's online courses that you can take. But local or regional or national meetings are typically good ways to obtain your CE, kind of the traditional ways.
Sure.
All right, doctors, we are out of time. I appreciate you both coming in today. Just wrapping up here, is there anything else that you would like to add?
No, I really appreciate you having us both on, and both of us feel real fortunate to be able to provide dental care and orthodontic care to the Muscatine community and the surrounding communities.
Thank you. Nothing
else to add, Doc?
Well, I appreciate you guys making the time and room for us this morning. It's been really enjoyable to, kind of highlight how we can all work together in this community to provide information to people and provide great, outstanding pediatric dental care and orthodontic dental care.
Do you have frozen toothpaste with like the frozen logo on it?
Yeah, they've got an Olaf one.
I know.
But I hear the next Frozen's coming out soon. So
I know, right?
Next year maybe. So we'll probably be gearing up with that.
Get a new logo on it. Yeah.
I'm sure they'll come up with something new because the girls are older, and we'll have to see. I'll have to probably learn some new songs to sing.
But the kids love that. I mean, they just love the movie. They love anything with Frozen on it.
Yeah, my favorite is Sven, the guy that eats Olaf's nose.
Right.
I didn't know you knew the lyrics. We could have started with a bit of a jingle today.
That was one thing that I was not blessed with, and that is a singing voice.
We'll spare you that. I don't think anyone wants to hear that.
But definitely, we do sing from time to time. But I try to let the kids sing. They have a much higher talent level than I do.
All right, doctors, thank you so much.
Thank you.
Thanks.
Mary, thank you. As always, it's a couple of minutes in front of 10 o'clock here at KWPC. This is the Voice of Muscatine. We'll have national and international news just around the corner. Hang on.
Fish and shrimp are back. They're back. They're back at Taco John's. Come get them by the sack. Because they won't last long.